So I'm here with Dr. Nandini Venkateswaran of Mouth, Eye, and Ear, and a member of the cornea service. We're going to just chat briefly today about some basic physiology and anatomy of the lacrimal gland and the ocular surface. Thanks for joining me, Dr. Venkateswaran. So to begin, can we just chat a little bit, just for a second, about some normal tear and lacrimal gland function?
Well, thank you so much for having me. I think the tear film is such an important part of the eye. It is actually the most powerful lens of the eye. But it's important to know that the tear film, coats the anterior surface of the eye, and it has three distinct layers. You have an inner mucin coating, a middle aqueous component, and a lipid overlay. So it's not that it's just, tears here and there. There are three distinctive layers to the tear film that are so important. And the lacrimal gland is actually an exocrine gland. So it's similar to, say, the salivary glands in our mouth, and it's located in the orbital part of the frontal bone. It's an exocrine gland, so that means that it has ducts that empty into the conjunctival fornix.
Great. And so I really am familiar with, obviously, the lacrimal gland, but I remember in residency somewhere along the line learning about these accessory lacrimal glands, and I've subsequently forgot every single thing about them. So could you just give me kind of a recap of what the accessory lacrimal glands are, where they are, what they do, if anything? I really just don't remember anything about them.
Yeah, so there are two main accessory lacrimal glands. They have great names, glands of Krauss and Wolfring. I hope that I'm saying those right. But the glands of Krauss, there are about 20 of them located in the superior conjunctival fornix, and about half as many in the inferior fornix. And I always remember K and K. Krauss stays in the corner, or the fornix. And then the glands of Wolfring are along the border of the tarsal plates of both the superior and the inferior palpebral conjunctiva. And so in general, these accessory glands account for approximately 10% of the total lacrimal secretory mass. I think what's interesting about these glands is that they're actually structurally similar to the main lacrimal gland in that they're also exocrine glands, but we don't fully understand their innervation. I think their role is ultimately at times underappreciated, as there are studies in which subjects underwent lacrimal gland removal who ultimately didn't develop full dry eye syndrome. So it's hypothesized that potentially the accessory lacrimal glands can be sufficient to provide basal tear secretion. So they really work as a backup. They can continue to help coat the ocular surface even if that main lacrimal gland has pathology.
It's funny, you don't really hear much about the glands of Krauss and Wolfring, but it does sound like that they are probably more important than we kind of think about or really consider.
Mm-hmm.
Not only is that kind of interesting too, but it sounds like that the fornix and the palpebral conjunctiva really play this kind of important role in the ocular surface, both for the homeostasis. Do you think that's relatively true, or do you agree with that statement?
Yeah, I think that's very true. The fornix houses the main lacrimal glands that empty onto the lacrimal surface, but also those glands of Krauss, remember Krauss corner. And the palpebral conjunctiva houses the glands of Wolfring, as well as important lymphoid tissue. So your T cells, your plasma cells, your antigen presenting cells, all of which initiate that inflammatory cascade of the ocular surface. So when you have ocular surface disease, not is it only a deficiency of, say, your tear film, but also, desiccation of the ocular surface and, persistent ocular surface inflammation.
Great, that was super helpful. I really appreciate kind of this really brief overview of just the physiology of the ocular surface. I can't wait to continue our discussion later down the road, where we talk a little bit about pathophysiology of conjunctival fornix and palpebral conj in our next conversation.
Awesome. This was great. Thanks so much for having me.
Of course, thanks a lot, Dr. Venkateswaran.